phone or computer. If anyone does not mute their phone, they will be muted by the call moderator or removed from today's call. Additionally, please turn off your camera if you are not a board member or the CEO and her staff. I will now read a roll call of the board to identify who is present. Please identify yourself first before speaking for the record. Commissioner Coy, Commissioner Esposito,
Commissioner Esposito present.
good afternoon. Commissioner Rooks, Commissioner Slater Harrington,
Commissioner Slater Harrington, present.
good afternoon, and I am present. Members of the public who would like to provide public comment to this committee can do so by signing up the day of the meeting up until 4 o'clock. Up to 5 individuals will be given the opportunity to provide comment to the Safety and Wholeness Committee. Speakers will be granted 3 minutes. All public comment should address safety and wholeness concerns. Individuals and or groups interested in providing comment to the committee may sign up in 3 ways. Email public.comment@bcps.k12md.us or call the board office at 443-642-4095 or visit us at the Alice G. Pender Hughes Building, 200 East North Avenue, room 406. Finally, the chat function during our virtual meeting today will not be used as a tool for gathering feedback, answering questions. If you have any follow-up questions, feel free to provide feedback to the board using the email schoolboard@bcps.k12.md.us. And the board office staff will provide you a response. Thank you all again for coming to today's meeting, as what we will be reviewing is extremely important. And we wanted to be able to take this time to delve into wholeness, mental health, um, including staff and principal supports. So I will give the floor to staff. This will be our only presentation for today, as today I expect to be a short meeting. However, we want to be intentional in leaving this space open for this topic, as it is paramount to our success as a district.
Okay, I guess it would help if I took the mute off. Good afternoon, good evening. Thank you for this opportunity. We truly appreciate you. Yes, we will be giving an update on wholeness and mental health supports, and also including supports that we provide for our students and for the staff. So first, I would like to start off by saying this is a joint presentation. And in this presentation, if we can go to the next slide, you will get a chance to hear from the whole child team, including Wholeness and the Office of Health and Specialized Student Services. But we are also joined by Human Capital, who's going to share some information with us, as well as related services. First, we wanted to start off with how we approach this work from a healing-centered crisis response lens. I'm sorry, if you can go back one slide, please. just so that I can make sure that everyone knows what's going to come up. So we're also going to show the restorative approaches, and then we're going to again be joined by our related services in the Office of Health and Specialized Student Services, so they can give their perspective and how they support on a daily basis, as well as how they intervene when there is a crisis in the building. I have some wonderful team members who are going to be joining me. And so I am actually going to turn it over to Eric Banzak first so that he can get us started, followed by related services. And then Dr. Pate is going to bring it home for us.
Good afternoon, Eric Banzak. Thank you, Edie Goodwin. So, unfortunately, when a crisis does happen at one of our schools, when we are notified, the Wholeness team is notified, we dispatch or send out our Healing Center Crisis and Response team. And that response time is immediate or within 24 hours. And that team um, that team then works with the principal and admin team in communication, or works with them and to help provide support and communication with stakeholders, assessment of needs, and individualized supports for adults and students. They also coordinate between the school and district leaders to assess needs. And then they also are in collaboration and planning with other offices like our EAP office for support for our staff members. And you'll hear a little bit more about that later on in the presentation. And then they also are in coordination with our related service office for providing counseling support for students. And again, you'll hear a little bit more in depth later on in our presentation about that. So when a communication plan is created and also a plan of support for the needs is created, our team then goes and focuses on restoring physical and emotional safety of our staff and students. And that response is continuous and ongoing. And they do that by modeling and implementation of SEL activities and restorative approaches. And I'll get a little bit more in detail in the next slide about the restorative approaches. And once the modeling and implementation is done, they go into our last stage, which is the most critical stage, which is the ongoing support and stabilization. And this is where they work with our community partners, and they also work with admin and central office staff to be able to provide that stabilization plan, because what we want to do, we don't want to do is walk away and they're not ready for us to walk away. We want to make sure that there's a plan in place to continue the great work that they have been doing in this time of need. So these are some of the restorative approaches our staff has provided to staff and students. When a crisis happens, they provide grief and healing circles to staff and students. They provide responsive circles to staff and students. And some of those responsive circles can be anywhere from how to move forward or just to rebuild or rebuilding and to move on. They provide safe space for grieving and counseling. These safe spaces are identified when the plan is created. It could be one room, it could be multiple rooms, depending on the size of the building. But these spaces are there for staff and students to come and be able to grieve and to work with counselors at any time throughout the day. And lastly is resources and supports for teachers. Some of the resources that our staff has given out to schools in time of crisis is just brochures on where to receive supports. They have worked with teachers and done mindfulness check-ins or wellness check-ins throughout the day with teachers. They've provided activities, SEL activities, and modeled SEL activities. And those activities could be anywhere as simple as arts and crafts for like painting or coloring, or we even done like name bracelets or building sandcastles. So like E.D. Goodwin talked about, not only with a crisis, but we look at like what are some of the preventative measures that we could provide our staff, throughout the district. And one of the things that we've been focusing now in the last couple of years is restorative practice. But how do we build an internal capacity within our staff to build that systemic approach? And one of the things that we have done is focused on the fundamentals and restorative conferencing training to all school administrators, which include principals and assistant principals. We've done that now last year and continued it through this year. We have provided that training to our central office staff and school-based staff as well. And we know that training just wasn't enough. We knew we needed to go deeper, and that way to build that internal capacity. So one of the models we looked at was train the trainer. or a TOT, and that was able to help us build the internal capacity at schools and also different central office departments. Since we are a large district and being able to provide that support, to provide the restorative practice or the restorative approaches, support when there's a crisis, or just to have a tool to have in their toolkits for staff. These 9 external partners you see here have been providing this support for several years now, and we couldn't have done it without them. These 2 partners that you see here are just going a little bit deep of what they have done in schools this year. Aquaben, we've been working with them now since the beginning of the school year, since August, and they are working with and supporting 5 schools in the whole school change and restorative practice. They're providing restorative support to several schools encountering deep challenges, and they're also providing the fundamental restorative practice training to all principals and assistant principals. And something new this year is they're providing trauma and restorative practice training to all of our climate leads. Another partner is Positive School Center. We've been working with them for several years now, and they've been in our schools this year since August, and they are supporting with 24 city schools, and they're supporting the supports that they provide are racial justice and equity, social emotional learning, student, family, and community voice, trauma responsive educational practices, and restorative and healing approaches. I talk about the preventative work, but also with the adult supports that they receive. So not only do they receive the preventative stuff, but the adult supports that they receive during a crisis. And these 4 vendors that you see on the screen here today has provided instrumental support to our staff during a crisis. MSDE has been an instrumental partner for us, that when there is a crisis, we were able to call them up, and they deploy their response team, and their team comes out to the school, and they work with our staff and be able to provide that counseling the staff needs in those safe spaces that are provided. Aquaben is another partner that we have used in the past. They have provided grief and healing circles to our staff, and they also have 2 psychologists on their team ready to support if needed. The 3rd partner is Monzi, which is the initiative out of the mayor's office, and they've been an instrumental partner with us. They have been at every crisis that we've had this year. They've been able to provide support to staff and counseling, but also be able to provide those resources that staff and the school needs as well. And lastly is our Cook Center. This is a partnership that was brought to city schools through Dr. Pate's office. And, it's a tremendous resource that is available to all city school staff. And it's a 24-hour hotline that any staff member at any time, not just a crisis, but could pick up and have access to a mental health counselor to be able to provide support. Now I'm going to turn it over to our EAP office.
Good afternoon, everyone. My name is Evelyn Jefferson. I'm the Administrator of Employee Benefits with the Human Capital Office, and I'm here to speak about our EAP resources. CompPsych is the administrator of these particular resources. When a critical incident occurs, we generally dispatch our EAP counselors out to our locations. Human Capital was initially contacted regarding the event. We received detailed information, the time that is preferred by the locations, and what may be needed for the counselor once they arrive to that particular location. Once a counselor is secured, the on-site contact is notified of the arrival time of the 2-hour session that they are provided. We offer group counseling as well as individual counseling if needed. If an employee feels that they need additional services, they can reach out to CompPsych on an individual basis and utilize the 6 free counseling sessions that are provided to each of our employees. Next slide. Okay, I'm sorry. In addition to our EAP program, my apologies, we are also looking to get additional services because amid a crisis, sometimes the immediate response of our staff is to be focused on the care of the students, and leadership are focused on the care of the staff, and they may not immediately focus on the care that they need for themselves. Once the situation calms down in a day or two, the gravity of the actual situation may set in and extended services may be needed. And while EAP offers the in-person on-demand crisis support, we are seeking to secure additional services that extend beyond regular EAP critical incident benefits, such as short-term trauma-focused counseling and assistance for all staff to cope with the aftermath of any type of traumatic event that they may have experienced. And that's it.
Thank you. Next slide, please. So when we speak about mental health supports from the Office of Special Education and the Related Services Unit, there are 2 disciplines out of the 6 disciplines who lead the charge around providing those mental health supports. And those are our school social workers and our school psychologists. Currently, our schools are provided a school psychologist at a 1 per every 850 student ratio. Each school is provided a 1.0, each traditional school is provided a 1.0 social worker. And then the underlying math behind that ratio is 1 per every 650 students. So there may be some traditional schools who actually have an allotment that's larger than 1.0 based on their actual size. Our school social workers and school psychologists primarily provide those mental health supports that are identified on a student's IEP or 504, but they also provide some general supports to the school as well. Next slide. So some of the general supports that those 2 disciplines provide are around crisis response. So their role is to assess the needs of a school during a crisis and to provide that support, as well as reach out to the related services central office staff when the need is greater than what they can provide so that we can deploy additional staff. They are also members of the team when a behavioral threat assessment is in need, and they support the school in conducting a behavioral threat assessment. They also work alongside teachers to support behavioral interventions and the implementation of behavior interventions. The last 2 years, our school psychologists had an active focus around supporting their schools around an attendance initiative, and most of them were on their school's attendance team. And both of those disciplines support the school generally by providing therapeutic groups. Those groups could be individualized based on an individual student need, or they also could be based on a school-wide need. And it could also be as a result of supporting sort of a long-term plan around a recent crisis. Next slide, please.
For our students that have IEPs and 504 students, they can access counseling services through related services that will be put on their IEP or their 504 plan, and it will be based on the individual need of each student, the amount of services they need. Our students that are in general education can receive direct counseling after being assessed for the need, and consent is given by their parents. Our school-based staff also refers students to our clinical staff that they have identified as needing more additional support. So if students have been identified in the classroom, there's behavioral concerns, they can refer to our clinical staff for additional needs and support. Next slide. Overall, this is our statistical data from 23-24, the amount of school psychological services and social work services provided for our students that have IEPs, as well as our students in general education. This gives you the numbers for the amount of individual services the psychologists and social workers have provided individually, the number of students, as well as the number of group counseling sessions that they have provided throughout the school year last year, as well as our general education students that provided psychological services individually and in group, as well as you'll see the last numbers at the bottom of the number of students with 504s that received individual counseling or from a psych or from a social worker. Next slide.
And now we are going to turn it over to the Office of Health and Specialized Student Services. We are joined by one of our superstars, Dr. Pate.
Good afternoon, everyone. So one of the primary focuses that we oversee here in the Office of Health and Specialized Student Services is supports around student wellness support teams. These teams are a collaborative group of mental health and healthcare professionals in any school community and can be made up of any of the following folks who work in the building, including school social worker, school psychologist, their wholeness specialist, counselor, nurse. If they have an expanded school behavior health provider, they're expected to be a part of this team as well, in addition to their community schools coordinator. Now, this is a district-wide initiative and all schools should have one. The primary focus of this team is to make sure that every student and family member in that school community knows at least one responsible adult that they can go to in the event that they need mental health services or supports. Next slide, please. So in order to support this endeavor, we had some funds from our Project Aware grant last year that we utilized to buy these t-shirts, so the members of that wellness team could wear these shirts, as well as these door stickers to use, so that people within the school community could readily recognize that they had a safe space where they could speak with someone about their mental health concerns. In addition, schools were also given banners to go on bulletin boards, because there's also an expectation that there is a student wellness support team bulletin board in each school, or some method where though those members of the community can identify the folks who make up this team. Next slide, please. The Expanded School Behavior Health Program is a program that's been in existence in city schools for over the past 30 years now. This program, we contract between Behavioral Health Systems Baltimore, which is the local behavioral health authority for the city of Baltimore, and city schools. Together, we co-contract with community providers in order for them to come into our schools and provide additional tier 1, tier 2, and tier 3 services outside of those that are provided by our related services staff. This program is currently in the RFP process for the next phase, in which we are actively reviewing proposals from new providers to join this team. Next slide, please. So our current providers, as of today, you'll see listed on the side of this slide, in addition to our just outpatient mental health providers, we also have some substance use prevention providers who are contracted through this program as well. So in addition to just providing therapy or group therapy sessions in schools, the members of this team also provide consultations to school staff and classroom observations. They have family outreach activities that they also are responsible for doing, as well as have the responsibility of participating in school teams such as student wellness support, SST, and they may even be members of the attendance team in some cases. Next slide, please. Here's just a snapshot of the ESBH program data for the past 2 years. As you can see, on average, we have about a little over or close to 11,000 unduplicated student users. Falling in that 10,800 range has been where we have been for the past 2 years. And the other metrics on here are the deliverables that the ESBH providers are held to as a part of their contract. Next slide, please. In addition to expanded school behavior health, the Maryland Community Health Resources Commission convened the Maryland Consortium on Coordinated Community Supports. Lord, that's a mouthful. This program is sponsored by the state through Carolyn. City schools' responsibility in this process is to provide letters of support for organizations who fall within the parameters of what we're looking for to expand our mental health supports and services. So during last year's round of funding, this is the list of folks who were awarded. In the appendices of this presentation are some slides to show like exactly what their work is and what the state has reported back to us that those organizations have accomplished. So with this project, City Schools does not manage this directly or these folks directly. All of their activities are reported to the state. They are moving to a process where Behavioral Health Systems Baltimore will be recognized as the hub for Baltimore City, and their activities will be reported to and monitored through Behavioral Health Systems Baltimore. Next slide, please.
And that concludes what we have prepared for you today. Commissioner Muhammad, we will turn it back over to you at this time.
Thank you. I appreciate it. I appreciate the time spent bringing this information together for the board. I know I have some questions from my fellow commissioners. In this case, I think that I'm going to get started first as I want to be able to move things quickly. I do have questions around usage, particularly if we can start with regards to services provided under EAP. When I listened to today's presentation, one of the things that I heard and at some points, and I did not hear consistently, was around support for our leaders, for our principals and staff as well. And I know that EAP does that work, so I would be interested in seeing or hearing the usage rates of staff and of principals.
Students. Oh,
Thank you. So we receive anywhere from 20 to 30 critical incident requests each year. I will have to get the scaled down amount for what is specific to each individual type of staff, whether it's principal, whether it's teacher, whether it's custodian, we can get those breakdowns. But of course, their information is confidential, but we can try to get the exact number of the type of position that is actually calling for extended services beyond when we dispatch a counselor out to the direct locations. I can get that information for you.
Okay. If possible, if you can get that to us so that we have it available prior to our next meeting, as it's something that we have further questions on. I'll just highlight that myself and another commissioner did a couple of school visits together. And one of the challenges that in talking with leaders is that the EAP services are offered by individuals who may not have relationships in our schools prior to, and that's understood. But because of that, we aren't fully making use of those services in a way that is helpful immediately. And then can you speak towards how many sessions after a crisis, if a person decides to work with EAP, how many sessions would a staff member have access to?
There are 6 sessions available for each type of reason that you're calling. So you could be calling for a critical incident at school, that's 6 sessions. You could be calling for a personal issue, that's another 6 sessions. So there are 6 sessions available for each type of issue that you may be calling for. And after those 6 free sessions, so those sessions are free, after those sessions are complete, if you need extended care or additional counseling, at that point, our medical benefits can then kick in to take up that resource for continued care.
And when we look at a crisis happening, one of those critical incidents occurring at a school, how many hours of the day are those individuals present at the school to be able to support our staff? And typically, how many individuals are sent out to a particular site?
So the initial timing is generally 2 hours that are offered. We determine if additional is needed based upon whomever is on site. If they feel that additional time is needed for the group sessions or the individual in person sessions at the location. If they feel that they need more than the 2, then we approve that, but we would need to be told that those additional hours are needed. And
So
I'm sorry, go ahead.
no, feel free.
Mhm.
Sorry about that.
I was going to say that we generally, depending on the size of the school, is how many counselors are dispatched. When it's our larger schools, then of course we try to get 2 counselors to come out if available. If not, then we can sometimes break it up between one day and then another counselor will come out the next day.
So those do we feel like those 2 counselors, and I'm offering this as a level of support, because if you have what you need, great. But if there's a need for more support, we want to be able to know that. So do you feel that we satisfy the needs of our staff and principals with offering 2 service providers for 2 hours after a critical incident on site?
So it would be dependent upon the location and the incident and the crowd themselves. So we can't determine in advance. Well, we can't really say whether that's enough or not. That's why we offer the additional 6 sessions if they need more outside of the initial meeting with the counselor for the 2 hours. And in addition to that, we're seeking to get additional support for that extra trauma care in addition to the EAP program. So unfortunately, I can't really say whether I haven't received any negative feedback to say it's just not 2 hours is just not enough. If that's the case, again, if they say that it is not enough, then we will dispatch another counselor out for an additional day or 2 if needed. And then we also have those independent individual sessions that the employee can reach out and get services for.
Thank you. I appreciate your responses. If I can move to related services, I just want some clarity around your work and who we are responsible for, particularly during a crisis, because you guys do a great job at providing services to our students who need it the most. Just want to be clear that during a school crisis, it is or it is not your responsibility to provide crisis-based services across the board to all of our students. And if you are supporting in that way, what does that look like? And does that create gaps in other places that we should also be providing services to?
So we are responsible to support all the students in a particular school building. And so we have a tiered crisis support um, process. But basically, what we ask our school-based providers to do first is assess. So we want them to, walk the building, talk to their administrators, assess the needs, go into classrooms to see, who are the students that may have been most impacted, and then determine if they are able to provide that support just within the staff that are assigned to that particular building. You may have a school because of the population or the size that could have 2 social workers or could have 2 school psychologists and 3 social workers, right? Because principals are also allowed to buy additional school social work support. So some of the numbers across the schools, may look different, and we may have schools who have, additional staff. So they do that first. They assess, and then if they believe that they need additional supports after having that conversation with the principal, after walking the building, after looking at those classrooms that may have been most impacted or the group of students that may have been most impacted, they reach out to our central office staff, the unit, the team, and we coordinate deployment from other schools. We try to do the assessment first because, one, we know kids like to be with those providers who they have relationships with, right? And we don't want to just deploy staff from other schools. And oftentimes, what we've seen in the past is we used to have a different process up until like 2 years ago where there would be a request for a crisis team. We would send people, and we had a lot of people who were missing from their buildings, but those students were not necessarily receptive to the support because those relationships weren't built, or there actually wasn't the need for that level or number of providers. And so instituting that process first has allowed us to be a little more strategic with when we deploy. So we are in constant communication, even when we get something over the weekend. LaWanda, Becky, Patricia, and Dr. Sy and I are on a four-way text, and we are making plans to make sure that the school-based staff is ready and that we also have who would we deploy if needed. And so that's how we made some shifts over the last couple of years to ensure that, one, we can get people there quickly if needed, but we also aren't sending people when they may not be needed. And so that's time that they're away from their buildings.
I appreciate that insight. And with that said, there's an agreement that the individuals, because when we create space for chronic stress to remain, it's damaging. And I know that, the presence that you guys bring in the related service office to our schools is that consistent person who our young people have relationships with. With that said, I'd like to move towards our restorative work, particularly around crisis. I think that the work that you're doing around restorative practices is amazing, but when it comes to crisis, what impact? What are the usage rates? What are the numbers around how our students are responding to these restorative uh, organizations that don't work in their school every day, coming to our schools for a short period of time?
So the restorative work you asked about the impact and for them to students to come, and that's it goes back to that relationship building, right? It goes back to making sure that we form the relationship so we could get down to the root cause of why they're not coming and how they support. And we look at what circles and what topics that we could provide throughout the crisis in that incident that happens. But we also want to work with the staff and to look at to see what we could do and how we could provide with them to see how then they could take that and then they could work with the students as well, because we know that the staff has a community as well. They have their own classroom to support the teachers and to support the restorative practice work. And it's supporting that teacher, and it's maybe working with them on how to implement the support of a restorative circle in their classroom and to be effective with it and to do that. So good. When I see you jumped on, did you have something you wanted to add?
Sure. Thank you for that response. I just wanted to add the work that you are leading around making sure that the administrators, each administrator in the buildings are being trained. Because as you said, Commissioner Muhammad, when we have people to come in who the students may not be familiar with, no matter how good they are, if the students don't have that relationship with them, it's going to take time. So we try to jump in front of that, or try to at least catch up with it, to make sure that the administrators in a building are trained, so that we can also take it and make sure that when those individuals who are coming in and doing the circles and talking to the students and trying to build relationships and getting them to speak, that the students don't feel as if we're coming in and then we're leaving. So we are attempting, or we are making strides in building the capacity of those who are at the school building. And in addition, we heard and we responded to us making sure that those who are supporting us with restorative practices are those who are local, because there is a context, there is background with Baltimore that those who may not live here may not have the historical context. So we are trying to approach it from that way as well, to make sure those who are coming in, they understand the historical context of Baltimore, and they're making sure that they are addressing concerns that are impacting our students here, as well as the adults.
I appreciate it. I want to open the floor for my fellow commissioners who may have questions.
Commissioner Muhammad, you covered a lot of my concerns with your questions. I think I've been asking for usage um, for a while now, but you asked from a staff standpoint in terms of mental health resources. I'm really still curious about student usage and if they're not accessing the services and we know they need the services, or what are the reasons why they may not be accessing the services? Um, so I'd like to talk about that a little bit more, or have that as a task that is brought back, an assignment that's brought back.
I appreciate it. I agree. I think that one of our concerns is the impact of chronic stress. When we have these incidents that we see that are going on in our schools, and the impact that it's having on our children, uh, and they aren't taking advantage of the immediate service given, what impact long term is it having on our young people's emotional health. And from an educational standpoint, we understand that chronic stress reduces our ability to be successful in the classroom. So that is of concern. Want to give Commissioner Esposito an opportunity to give comment or question if there's anything.
Nothing for me, but yeah, I support what y'all are asking for. I'd be interested in seeing that as well.
Thank you, Commissioner. I'll say that one thing we heard today and what we walk away with is that there is a very robust effort to be able to provide support to our young people, whether it be from outside resources to our related service, giving providing direct services to our young people who need it the most, to our expanded school efforts. Uh, there is a robust effort to be able to assure that our students are whole. And I wanted to make that clear that that exists. However, I think that one of the gaps that we see as a board or area of growth is the level of support that our teachers and our principals have, just because we see gaps. If a teacher does not necessarily have a planning period until closer to the end of the day, and our services that we are providing are there for a block of time that does not align with that, or there's a principal who's overwhelmed and providing service and ensuring that his or her children are whole right after a crisis in their building, and their time does not align with that support, then we might want to find ways to assure that they are whole, and that may come in the form of what we're offering, or we may need to think of creative ways to be able to mirror some of the things that we are doing for our students to assure that our staff are whole as well. I think this is powerful work that you guys are doing. So I want to thank you for that. And we are going to close out with that. Thank you again for today's presentation. For now, we're going to move out of this session into our closed session, but I will need a motion to close today's meeting to move the board into an administrative function in accordance with the Anecdotal Code of Maryland General Provisions. Do I have a motion to close?
So moved, Esposito.
Thank you, Commissioner Esposito. Do I have a second? And I will second that. But before we do, are there any members who object to us closing today's, members of the public, excuse me, who object to us closing today's meeting? Hearing none, we will see you guys the third Thursday of next month. All in favor of closing, Commissioner Esposito,
Yes.
Commissioner Slater Harrington,
Yes.
and I am in favor. Thank you all. We will see you next month. Looking forward to those updates, which we will hopefully have to be able to update the public in our next meeting.
Thank
Have a
you.
good one. Bye.
Bye-bye. Bye-bye.